So we're going to take a look at some pectoralis anatomy, and we've got two muscles that make up that group. There's pec major, fiber direction like this, and then we've got pec minor, fiber direction like that. They occupy a similar space, but actually they're two completely different muscles that act on different joints. So we're going to reveal some of that now. Let's start with pec major, which is the most superficial. Pec major, insertion, we've got the cartilage of the first to the sixth ribs. So depending on how lean someone is, the muscular development, sometimes you can see this extra little bit of pec major just there underneath the nipple, and that is onto the sixth rib. That's the sort of lower end, the inferior portion of this muscle. Also originates at the sternum and the medial half of the clavicle. So it's got three big, strong insertion points there. The muscle fibers come laterally, and actually what they do is they flip almost 180 degrees and insert onto the crest of the greater tubercle of the humerus. So inserts onto the humerus means it must act on the arm. And we've got a lot going on here with pec major. We've got upper fibers, we've also got lower fibers. All of those fibers together medially rotate the arm and adduct. So they bring the arm in and they rotate in. That's all of these fibers working together. Then we separate them into the upper half. So the upper half flex the shoulder, they bring it up, and the lower half extend and they bring the arm down. So actually pec major is an antagonist to itself through its different fibers. The last thing they do, which is perhaps the most obvious one, is horizontal adduction. So think bench press, that type of movement there. So that's pec major. Let's remove pec major, and then we've got pec minor underneath. So unlike its bigger brother pec major, pec minor acts on the scapula, and that's where it inserts onto the coracoid process. That would be this little anterior projection of the scapula that actually comes all the way through the shoulder girdle and sticks out somewhere there. It's quite tender. If you start poking around there, people are going to say ouch, so just be mindful of that. We've got chiropractor that also inserts onto that, as well as the short head of the bicep. So a few different muscles that insert there. The origin is going to be the third to fifth ribs. So we've got a muscle that goes in this direction here. And this is a muscle that actually interests me a lot as a practicing therapist, because a lot of people that come in will have this shoulders rolled posture because they spend too long working behind a desk or just with unfavorable posture generally. And this muscle, pec minor, shortens in that position and just gets used to being in that position. So anything beyond that feels like a stretch. So a very important part, lots of work required there for a lot of people in my clinic at least. It does not act on the arm because it doesn't insert on the arm. It inserts onto the scapula. What does it do to the scapula? It depresses the scapula. It protracts the scapula, and it downwardly rotates the scapula. So there are three exact actions of that poor posture position that people find themselves in, and that is why that muscle becomes a victim. It's not necessarily the cause, but it can be the victim, and then it can exacerbate things by becoming short and tight and stubborn. Pec major and pec minor also have some actions involved with respiration, and that is because they insert onto the ribs. Anything that inserts onto the ribs usually assists with inhalation at least, sometimes possibly exhalation, but with pectoralis major and minor, it's inhalation. The most important thing here is that they can only do that if the arm or the scapula is fixed. So let me explain. Let's take pec major for instance. It inserts onto the humerus. If that arm is fixed, then the muscle in its contraction is not now going to do anything to the arm. It's actually going to act on the origin. So it's going to elevate that rib cage. So that's forced inhalation. If you're just being for a sprint and you're absolutely heaving to get the oxygen in, that's going to be working there. Same for pec minor, but this time if the scapula is fixed. So when it's not acting on the insertion, that's fixed, it's going to act on the origin, which is of course, as we said, the third to fifth ribs. So another important part for you to analyze and to assess is the patient's breathing. If you think that there's tightness in any of these respiratory muscles, it might be that they're being used to inhale more so than the primary muscle of inhalation, which would be the diaphragm. So another reason that this poor posture, desk-bound existence can be a negative thing, and how the pecs can be involved. So there's a bit of anatomy for you for the pectoralis group, pectoralis major and pectoralis minor.